ADHD, or Attention Deficit Hyperactivity Disorder, is not included in IDEA as a separate disability classification, but falls under Other Health Impaired if it is evident that the individual's disorder impacts their life adversely. Instead, a clearer definition is referenced from the American Psychiatric Association as a neurodevelopmental disorder portrayed as a persistent pattern of inattention and/or hyperactivity impulsivity that interferes with the functioning or development, referenced from the DSM-5. This is a chronic condition that can be exhibited and diagnosed at any age. This disorder, in layman's terms, involves an individual's inability to control their behavior, focus, or activity. 6.4 million children ages 4 to 17, or roughly 5% of school-age population, have been diagnosed with ADHD. However, experts have found almost 9.5% of children in this age range exhibit ADHD tendencies. All indicators and characteristics must occur repeatedly over time and differ from age-appropriate behavior. These could include difficulty concentrating, being forgetful, unable to sit still or maintain self-control, being withdrawn, impulsivity, low academic achievement, and organizational trouble. The chronic nature of these behaviors must be present for at least 6 months to be considered indicators. Historically, ADHD-associated behaviors were labeled as defective moral conduct and have been through a multitude of labels such as Strauss syndrome, minimal brain injury, and hyperactive child syndrome. All of these phases reflect attempts of researchers to pinpoint the cause of ADHD. While there are several hypotheses, there have been no scientific conclusions as to what causes ADHD. Boys tend to get diagnosed 3 to 4 times more often than females, primarily because they tend to display the hyperactivity symptoms, while females tend to display the inattentive symptoms. Individuals with ADHD are often diagnosed with other impairments like learning disabilities, oppositional defiant disorders, conduct disorders, anxiety and depression disorders, bipolar disorder, and Tourette's syndrome. Diagnosis involves a multidisciplinary team and can involve medical screening to rule out other biological causes for exhibited behaviors, such as a tumor. Behavioral tendencies at home and school will be tracked, and a pediatrician will often refer the family to a mental health expert for further evaluation and testing. In the classroom, teachers may notice the negative effects of impulsivity. This can be seen in random outbursts, excessive physical motion, and confusion or disorganization. These behaviors often lead to difficulty making friends, low self-esteem, and low academic performance. Cultural differences, seen as indicators of these behaviors, can also lead to overdiagnosis, especially in African American males. ADHD is a lifelong diagnosis and not something one grows out of. Adults with ADHD change jobs 3 times more than adults without ADHD. Adolescents tend to engage in higher risk behaviors than their peers, and the impulsivity, inattentiveness, and hyperactivity continue to impact most major areas of life throughout adolescence and adulthood. Treatments can vary depending on student. Medication is generally successful in about 80% of prescribed users and includes stimulants such as methylphenidate, marketed as Ritalin or Focalin, or amphetamines such as Dexedrine, Adderall, or Vyvanse. Other medications such as Strattera or Wellbutrin have been used. These can have a variety of side effects but are intended to serve the purpose of increasing an individual's ability to focus. It is crucial that instructional strategy is reinforced both at home and in the classroom. The U.S. Office of Special Education Programs recommends a set daily routine to aid the student's ability to stay organized. Use of visual aids such as the task chart or posted time schedule increases the student's ability to predict and prepare themselves and exercise self-control. According to ADHD, A Teacher's Guide, giving clear, concise directions about one task at a time instead of introducing a multitude of tasks can help that student stay focused. Written directions, repeating directions, or having the student summarize expectations can also be helpful to solidify the individual's comprehension of expectations. The Department of Education ADHD Teaching Strategies recommends using small group learning settings to allow students more focus time with appropriate peer modeling. This can also help increase their ability to focus as they will have a larger involvement in the activity or lesson. These small group learning settings should also occur in an environment with least distractions, for example, not near a noisy window. A behavioral contract or management plan should also be established to allow the student full knowledge and clear understanding of expectations and consequences. This can allow, for example, responsible use of an escape valve, in which a student is allowed to step out of the room if their hyperactivity needs an outlet. Visual cues or agreed upon signals to correct behavior can also be used. Perhaps the most important instructional strategy teachers and parents need is understanding. Being able to judge when a behavior is unintentional and then react appropriately is important to helping the student learn how to manage their ADHD. Ignoring unintentional misbehaviors and presenting consequences in a logical, respectful manner to intentional behaviors is crucial. There are many common myths about ADHD, such as that it is simply a lack of willpower or self-control. Many biological studies have shown that people with ADHD often exhibit delayed cortex development, according to the National Institute of Mental Health. UCLA professor M. Barry Sternum research supports these biological connections and negates this myth. Another popular myth is that everyone has symptoms, and if you are smart enough, you can overcome them or outgrow them. While many people occasionally display ADHD behaviors, the chronic nature is the key and most life-impacting difference. As ADHD can also be diagnosed in adults, this is not something that one can grow out of. The immense increase in the last decade has led to public declarations that the diagnosis is reflective of society's decline, a quick fix for lazy educators and parents, or a gateway to a drug-dependent generation. The Surgeon General, General Accounting Office, White House, Drug Enforcement Agency, Congress, and National Institute of Mental Health have all conducted studies and disproved this theory. The National Institute of Mental Health is currently exploring alternative diagnostic and treatment methods. The multimodal treatment study of children with ADHD, also run by the National Institute of Mental Health, is exploring the use of antidepressants as an option for treatment. However, there is no cure for ADHD at this present time. While it may seem like ADHD is a vague, difficult disorder and can cause a lot of frustration and difficulty both at home and school, it is important to remember that there are a number of options available for support. If the student's ADHD is not severe enough to qualify under OHI, they can still be provided with a 504 plan. Collaboration and communication can lead to success.